Sometimes as caregivers, if our patients begin to fall, we instinctively want to reach out and catch them. If we do this, we put ourselves and our patients at risk. That's not a good idea. Controlling a fall instead is a much safer approach. Hi, I'm Sharon Snar, physical therapist and certified professional ergonomist with State Fund. Safely controlling a fall requires good body mechanics and positioning, which we'll cover in a minute. It also helps a lot to have something strong to hold on to when you're moving your patient. And for that, I recommend using one of these, a gait belt. Gait belts are often used with patients who can't easily walk on their own. It essentially acts as a handle, so you can more easily grasp and stabilize your patient when walking together or transferring with them, say from a bed to a chair. Using a gait belt is pretty straightforward. I'll quickly demonstrate for you. First, secure the belt around your patient's waist. This is important because the waist is near their center of mass. Tighten it firmly, leaving a couple fingers of space between the belt and the person. Keep in mind, it's more comfortable to have a layer of clothing between the gait belt and the person than to have the belt directly contact the skin. Any extra length of belt you have can just tuck in securely. As you walk with your patient, keep one hand on the gait belt, grasping it with your palm or thumb facing up behind your patient's back. You can place your other hand gently on their shoulder for added guidance. It is best to stand to the side and slightly behind as you walk with your patient, and walk slowly. Make sure you have firm footing on the ground at all times and maintain a wider than normal stance. Positioning yourself on your patient's weaker side can help you better maintain control. Now, if your patient begins to lose their balance, you can reorient them with the gait belt. Use a gentle side-to-side motion to help them regain their balance. Avoid using quick or sudden firm movements, since that can result in overcorrection and cause both of you to lose your balance, which wouldn't be good. Also, avoid pulling up on the gait belt to keep your patient upright, since this would require you to hold their weight up against gravity with only your arms. Unless you're Superman, this is unlikely to work out well for either of you. If you are unable to correct the imbalance and your patient begins to fall, don't try to catch them or prevent them from falling. Instead, use the gait belt as a handle as you gently lower them to the floor. This is key. If you can, move behind them, take a small step back and widen your stance. This will increase your own stability. Next, grab the gait belt and guide them back toward you and onto one of your legs. Then, slowly lower them down along your leg gently to the floor, making sure to protect their head. During the patient's descent, keep your body as close to them as possible, lowering yourself down along with them as you guide them safely to the ground. To reduce the risk of injuring yourself, you can improve your body position by dropping down to one knee or by bending your legs as you control their descent. At this point, you might need to move slowly backward as you lower your patient to make room for them on the ground. Once they are either sitting or lying safely on the ground, assess their condition and then call for assistance. The real key with all of this is to have a plan ahead of time and to practice the techniques in your plan so that in an event of a fall, your reaction is to assist your patient safely to the ground with the best body mechanics and positioning that you can. For more tips like this one, visit www.safeatworkcalifornia.com, where you'll find lots of resources to help keep your workplace as safe as possible. For all of us at State Fund, thanks for watching, and we'll see you next time.